If you're thinking about becoming a surrogate, you might be wondering, what are some of the rules that surrogates follow in a surrogate pregnancy that are different from normal pregnancy? Many surrogates want to know how this experience is going to be different from their own pregnancy. And that's a really good question, because in surrogacy, there is an added layer of caution that's taken. So many resources go into this process: time, energy, and also financial resources to make surrogacy possible. So every contract is going to have some different things in it that are outlined for the surrogacy to help the process go smoothly and safely and give the best chance of success. It's really important that you check your specific contract when you work with your attorney to really understand everything you're agreeing to do for your surrogacy. Some of the things that could be in there are agreeing to follow medical instructions. That means following all the doctor's orders from your OB or IVF doctor for the surrogacy. That could mean following medical instructions for medications, attending appointments, not receiving care from outside providers without prior approval, and really just ensuring that you're doing everything medically by the book and following all those recommendations in the best interest of the pregnancy. Abstaining from recreational drugs is important. Obviously, surrogates can't be partaking in cannabis or alcohol. And some of these restrictions do start from the time that you start IVF medications, whereas others start from the time you sign contracts. So it's really important to pay attention to the timeline of when those restrictions are being enforced. It's important that you're not engaging in high-risk activities like contact sports, intense exercise, commercial boating activities, horseback riding, to name just a few different things that can be excluded. You are agreeing to not travel outside of the US during the course of the surrogacy. We don't want you getting stuck in another country or traveling to a Zika area where that poses a risk for baby's health and safety. Most contracts are going to require that you remain in your own home state around 24 weeks of pregnancy and on. And the reason for that is to ensure that your medical bills get covered under the insurance plan and that the parentage process goes smoothly, because surrogacy laws do vary from state to state. They're not federal. It's important that you relay all medical updates to the intended parents and the agency so everybody can support you in the process. So your contract will stipulate that you do need to keep everybody well informed, and that's really in your interest too, so everybody can support you and make sure you have what you need. You do agree to abstain from sexual activity from the time you start injectable medications or hormonal medications until cleared by the IVF or OB doctor, and usually that's after pregnancy is confirmed and stable, because you don't want any chance of conceiving outside of the surrogacy. The medications that you're on do increase fertility, and you don't want any added risk there. You will be asked to include the intended parents on medical decisions. Things like termination and reduction or any kind of genetic testing are things that need consent from the parents. Receiving vaccines will need consent from the parents too. Really, any area where both your health and baby are impacted is a group decision to be discussed. There may be some other lifestyle restrictions, and those may be things that are super common that you've heard of before, not dyeing your hair in the first trimester, avoiding certain foods that have raw ingredients or a higher risk for listeria. So taking that into consideration, you may be asked to not handle cat litter or consume herbal supplements that haven't been cleared. And really, all those things are in place based on best practices that OBs recommend. Sometimes parents have specific requests about organic eating or different lifestyle things, but that'll be specific to your contract. And you'll be asked to follow current COVID safety protocols. Right now, that is a hot topic. I know everyone's a little tired of hearing about COVID, but it is still super important that everybody is as careful as possible for the health and safety of the surrogacy and your health and safety. It's important that when you do get your contract that you do print out this list and revisit it periodically, because it can be tough to keep track of all the things that you agreed to if you don't check it once in a while. If you're ever not sure, you can go back to your attorney or the agency for clarification. Overall, your goal as a surrogate is to do everything in your power to ensure a healthy and safe pregnancy for you and for baby. There's so much that you can't control in a pregnancy, so it's important to do the right things where you can and where you can make your difference, to do everything in the best interest of things going smoothly. The 9 months that you're going to carry this baby is a really critical time for baby's development, and there's a lot of trust that goes into a surrogate from the intended parents and the agency to do the right things. While there are things you can't control, your actions and choices can directly impact the outcome, so it is important to do your best and to ask for support when you need it so that you can adhere to what you've agreed to. Surrogates, at the end of the day, you're making miracles possible, and everything you're doing is so deeply appreciated and so meaningful. So, know that it doesn't go unnoticed, all the things that you do to make this possible for somebody else. It really is deeply appreciated. If you have any questions or want to learn more about being a surrogate, feel free to reach out to us at Hatch, and we would love to hear from you. All right, you take care. Have a fantastic week. Bye.